Michelle Johansen, an assistant professor of neurology in the cerebrovascular division at the Johns Hopkins School of Medicine, an associate faculty with the Welch Center in the Bloomberg School of Public Health. I'm here today to talk to you about one of the great sessions at the American Heart Association Scientific Session Meeting, of which I'm thrilled to be a part. It's entitled Neurocardiology, Fostering Collaborations Between Cardiology and Stroke Services. This is a joint session between the AHA and the World Stroke Organization. I'm a moderator for the session where speakers will talk about the importance of coordinated interaction between cardiologists and stroke physicians. I also have the privilege of specifically lecturing on the global burden of cardioembolic stroke in young and elderly populations, talking about the commonalities between stroke and heart disease. The good news is that stroke incidence, prevalence, and mortality declined from 1990 to 2017. However, stroke is still the leading cause of death worldwide after ischemic heart disease, or only number 2. When we think about the young adult, there may be a wider range of potential risk factors that need to be considered. And importantly, there are unique considerations when thinking about stroke in the young adult. For example, these patients are in the middle of having a family. They may be at the height of their career, and they may have young children at home. Risk factors for the young adult, however, do have overlap with older adults, specifically cardiovascular risk factors. They're important. Things like atrial fibrillation, diabetes, smoking, cardiovascular disease. All these things increase risk of stroke in the young adult, just like they do the older adult. An area in which I specifically do research and share some of the results during this talk include cardioembolic stroke, or strokes where the clots come from the heart, an embolic stroke of unknown source, where it seems as if the source of the stroke may be the heart, but the exact cause remains unknown. The reason that figuring out the cause of the stroke is so important is that the treatment for stroke depends on the type of stroke that a patient has had. Right now, atrial fibrillation is basically the only cause of heart problem that is treated with anticoagulation. So it may be that younger adults with these embolic strokes of unknown source, if they had specific changes in their heart, would benefit from anticoagulation. We may be able to diagnose and treat more causes of stroke in the young adult. We're doing a lot of exciting research in the Johansen lab regarding stroke etiology, or the cause of stroke, and I recommend that you check out our website to learn more. The older adult with stroke struggles with disability, and the absolute number of people who develop new stroke, survived, or remained disabled doubled over the past decade. Importantly, 80% of incident stroke burden is in low to middle income countries. So collaborating with cardiologists in other countries as stroke neurologists is imperative. One of the things that is incredibly important to consider in stroke care, and for cardiologists who help take care of patients with stroke, are the memory problems that develop in older adults. While some may recognize that symptomatic stroke lead to cognitive decline, many do not realize that silent strokes, subclinical strokes, can occur in quote-unquote healthy older adults and may also lead to cognitive decline or memory problems. I present some research and results during this talk where we look at participants' heart in a large epidemiology cohort study and found that people with left atrial dysfunction, which is a particular part of the heart, were at increased risk of having an imaging marker of a brain change that's necessary to develop Alzheimer's dementia. Could it then be that cardiac disease might be a direct cause of brain injury? We discuss that maybe through strokes or subclinical strokes or a lack of blood flow to the brain or other mechanisms, cardiac disease might play an important role in cognitive impairment. Finally, all of this is really to draw forth the importance in working with cardiology. As a stroke neurologist, I'm thrilled to be a part of the Chickaroni Heart Prevention Center at Johns Hopkins. Together, we can work together to think about patient selection for novel diagnostics, therapeutic strategies, developing guidelines and practice updates, and taking care of our stroke patients. I recognize that I can't take care of a stroke patient without a cardiologist providing expertise on cardiac structure and function. And that helps me do a better job diagnose the stroke mechanism, perform a complete stroke workup, and think about the best treatment strategies and evidence in taking care of both my young and old patients with stroke.